Welcome to the Million Vegan Grandmothers podcast. And today I have Suvetha Kannappan. And can you pronounce that for me, just in case I mispronounced it slightly? Your name, please.
Suvetha Kannappan.
Great. Thank you so
Suvetha
much.
Kannappan.
Awesome. Thank you. Thank you so much for being here today on our podcast. Dr. Sailesh Rao, touring India and doing some beautiful work there, brought your presence to the Million Vegan Grandmothers and is really absolutely gifted energetically by the work that you're doing in community medicine. I just need to see your whole face a little bit. I can't quite see the bottom. There we go. Thank you. So I read a little bit of the website of the physicians that have come together and the professors, and you're a professor of cardiology medicine. And in your community hospitals, you also have a teaching facility where you're teaching physicians how to heal, really, how to promote. I noticed there's yoga and naturopathic medicine and plant-based medicine. And so it's not just a community where you're taking care of other communities that need support in poor areas that don't have any healthcare, but you're also teaching physicians how to do this work in a holistic way. So thank you for your work. It's amazing, and it has such a long outreach. Can you tell us a little bit about yourself and how this came about?
Tammy, and actually I'm overwhelmed and humbled by your invitation to be part of this global work you're doing. And I'm going through the website and the kind of work you're doing. I feel very minuscule and I don't know, it's just a drop in the ocean probably, which we are doing. And it is a great honor to be invited to be part of the climate healers and the Million Vegan Grandmothers community. Hope I would be able to contribute in future to this community in a small way, if possible. So with that, myself, I'm Suvetha Kannappan, and I've specialized in public health and lifestyle medicine. And I have a keen interest in non-communicable diseases right from my undergraduate days. And I have been trying to have a healthy lifestyle. And this, I thought, should be beneficial to the patients and the community as well. So with this interest, I got involved along with teaching public health. I also got involved with the cardiovascular health promotion through the preventive cardiology department headed by Dr. Rajendran, who is equally and if more passionate about preventing heart problems rather than treating them. So we together, we are involved in primary and secondary prevention of cardiovascular health problems. And one of the key features of our programs are promoting a whole food plant-based diet. Along with that, we promote physical activity, we do stress management, we tackle sleep problems, substance abuse, and social connectedness, which we call the 6 pillars of lifestyle medicine. We see to that all our programs, all our patients and the community who we target have a holistic healthcare targeting all these 6 pillars of lifestyle modification.
Beautiful. Well, you're a river. Your river is pouring into our oceans, not just drops, that's for sure. And what really moves me about your work is that I'm also a holistic nutritionist, and I see so much symptomatic treating and labeling. And I'm reading a book right now by a doctor I really love called The Myth of Normal. And what we do is we hold people up to how they should behave, and we give them a diagnosis of mental health, but we don't get to the core of all of the different things that brought them to their coping, they're adapting to life, whether it's addiction, whether it's a childhood wound, and then the combination of putting toxins in their body that, really is very hard on their gut and their brain, and you're addressing all of those at once. Their disconnect to their social community, their inability to know how to eat properly, their inability to know how to soothe their mind in a natural way that helps them heal. You're addressing all of that. So thank you very much.
Yeah, as I told you, it's the passion, and we try to have a healthy lifestyle, and that's what makes it possible for us to talk to our patients, because we know the positives and negatives of and the challenges in adopting a healthy lifestyle. So since we follow one, so when we are into this, we know like where are the challenges and what would be the obstacles for our patients, and we do not, as you said, we do not treat the diseases. Actually, we get it from the patients as to what their needs are and what would is possible for them within their limits, within their cultural beliefs, their community from which they come from. All these factors are considered when we talk to our patients and try to help them out in bringing a healthy lifestyle. So that's the whole point, as you said, treating them holistically rather than targeting on the disease.
Beautiful. So how many hospitals are you a part of as a professor of cardiology medicine and all the other outreach work you do? And can you tell us tell our listeners how many people that you're impacting daily, and how many communities and families and
Okay. So let me start from what we are doing in the hospital. So I belong to a medical school which has a hospital attached to it. So we have patients with the high risk of heart disease coming to us, and patients with heart disease who come get admitted. So this is one population which comes to us. So those with high risk for heart disease, after getting the treatment from the cardiologist, we are a team of preventive health physician, social worker, psychologist, physiatrist, yoga and naturopathy specialist. All of us come together, and we counsel the patient on the various aspects of lifestyle modification. So that's one thing. The other part is patients who come with a cardiac ailment, who get admitted with heart disease, let's say a heart attack. So what we do is right from the day they get admitted in the intensive care unit, we have started the rehabilitation process. So the rehabilitation focuses both on physical and mental health, but the key component here would be physical rehabilitation with the help of the physiotherapist and diet counseling, along with focus on psychological well-being and with then other yoga and naturopathy also being part of the team. So that's one thing. And with this, we don't stop with this. Our focus is that people should not get into heart disease. So people who are asymptomatic, who are having a high family history, like the family history of heart disease, who are at risk into getting into heart disease. So they are our main focus. So primary prevention is key for us. So we have a cardiac master health checkup program where we diagnose heart disease at its earliest, the risk of heart disease at its earliest, and then again we give a holistic care and continuous and sustainable care. So we follow them up once they come to us. We follow them up continuously and see to that they are adopting a healthy lifestyle. It has its own challenges, but still we do not, we along with these challenges, we are not like we don't get upset. We just try to go ahead and then overcome these challenges and see what we can do for them. So these are some of the programs which are going on in the hospital. In the community, we do some kinds of programs like targeting schools. School is the place where the change has to start. Children are the key focus because they are the future of the nation. And when we create a community of healthy children, they, I think, will be the future of any nation. So we have programs in schools, colleges, industries, where health education intervention is the key component of our programs. And we have an adopted village where we do heart health promotion. So we target families, and there we don't stop just with educating them. We also look into how we can bring about environmental changes. So, and a change, like for example, creating a favorable environment for them to exercise. So those kind of opportunities and facilities we try to provide so that they live in a community which helps them to adopt a healthy lifestyle, promote kitchen gardens. So these are some of the interventions which we do. Apart from that, now our next focus is on targeting women because women are at high risk for heart disease and which we are not aware of. So many of the women think it's heart disease is for men. So, and another point is that when women are empowered, they are the key or the heart of the family and the community which they live in. So we thought that during the process of educating them about their risk for heart disease, we would also try to empower them as agents for change for their families and for their community. So that's the next program we are looking into. And some of the other aspects are, as I told you, like tackling pediatric obesity, like which is a growing problem in India and across the world, as I think. So that is another thing which we are looking into because children are at high risk for heart disease because they have many of the metabolic problems like obesity, early onset of diabetes and hypertension. So that is another aspect which we are looking into and starting out clinics and outreach activities to help those at risk for these metabolic diseases.
It's amazing. It's so outreaching. You know, like I feel when you said that you don't get frustrated. And that is the problem, you know, if we live in a judgmental attitude that they're just not making the changes, then we tend to get frustrated because we're judging, as opposed to saying, this is a community issue, this is a global issue, that we're all kind of victims of a system that misinformed us. And so what it is it's bringing back the memory of truth, that we know how to live in a healthy body and with a healthy mind and a healthy community. So it's basically restoring truth and love to a community on some level through education, but also through caring for these people until they know what to do for themselves, but taking a systemic view. I used to be a social worker, and you know, one of the things that our professors used to always say to us is children were not born in a vacuum. So when we bring children to therapy because they're having a disorder, or we put them on ADHD medication for attention deficit, we're seeing them as a vacuum, but we want to know what's going on with their body, mind, spirit, community, family, you know, and that's what you're doing. So thank you for that. So tell us some of the great results that you've had, some of the changes in the communities that you've been part of, and what you've seen happen over the years.
Okay, so one of the aspects, like let's say the programs which we have been doing in the hospital, it was a great challenge initially because to develop a team was one of the challenges. But then having a team of like-minded individuals, let's say a dietitian in the team, a physiotherapist in the team, a psychologist in the team, a social worker who speaks the same language. That was building that community under the leadership of our cardiologist was Dr. Rajendran. He took the initiative and we built a good team. That was the first important factor. I would say a success, because without a team, I don't think we can have an impact on the patients which we are looking into, or the community of relatively normal individuals which we are looking into. So that was the first important thing. So we have a very good team of people, like-minded people who speak the same language. So then the second aspect is getting them to know, create awareness about the preventive health programs which are happening within the hospital, which was that was the first thing through social media and different ways. We tried to create awareness about the programs which were going on. Initially, it was a challenge to get people to come to the program. And once we had people coming into the program, we see a huge, whole lot of difference in their eating patterns. The first, like, let's say, people started adding one fruit per meal every day, from eating just 1 or 2 servings of fruits a week. So we started promoting what is good. So we see a lot of changes, especially people that taking more fruits and vegetables. So that was some changes we have seen in the patients, which is very difficult to achieve. The other positive thing is in the community is people, more industries, more schools, more colleges are want us to give health awareness to the staffs, their students. So that is another positive thing which we are seeing. So more awareness on this aspect about preventive health has been slowly gaining impact. So that is another important thing. When I say about the villages which we are working in, it is still a challenge because when people are apparently healthy, they wouldn't know the benefit of adopting a healthy lifestyle because they are not still ill. So that is one of the challenges when we go into the community. So the impact on the community is yet to happen. But I would say in the hospital, having a good team, people having more awareness and coming to us for identifying the risk of heart disease, trying to change their behaviors, and adopting a healthy lifestyle, and more institutions, schools, colleges, and industries wanting to have our programs are some of the successes which we have seen in the recent few years.
It's beautiful. And so lots of Indian people in different regions are vegetarian, but a lot of them still do dairy. And it's making that connection also between dairy and heart disease. And how is that going? Because I know that there was the myth of the holy cow and that that could continue, that tradition can continue, but we know it's not true. And there's been some great documentaries that have revealed that over the last little while. The Land of Ahimsa, and it's slipping me, Mother's Milk, Makadu.
Makadu. Yeah.
Makadu. And so we're getting to see that this impact of animal agriculture, period, using animals in any way, is not sustainable for the planet. Have you been successful in your campaigns making the connection between healthy me, healthy planet yet?
Yeah. So to be honest, I would say that we were promoting whole food plant-based diet, and we do give plant-based diet for our patients for the past few years. But our focus was entirely on the health benefits. Okay, so let's say if you have a whole plant-based diet, your risk of diabetes decreases, your risk of heart disease decreases, your risk of hypertension decreases, your risk of obesity decreases. This was our focus, though its impact on environment was in the back of the mind. And Dr. Rajendran was like always, it was there with him also. He was having more of that thought. But then in the recent past, let's say in the last 1 year, we had more opportunities to talk about this through some of the programs which we conducted for students, through the Physicians Association for Nutrition, where we talked about evidence-based nutrition. There, we saw that among the students, when we spoke about plant-based diet and its impact on environment, students took it better than when we spoke about plant-based diet and diabetes, or plant-based diet and heart disease. So the reach was much better, and that kindled our thought. So I think this is the key factor which we have to promote amongst our students as well as for our patients. So we started looking into more of that. Though it was in the back of our mind, I think we started giving importance more on this aspect of plant-based diet, its impact on the environment, more thought on that. And that's what made us bring Dr. Sailesh Rao to our institution. And they gave I think probably a life-changing talk to the students and to us. So, but it is, I would say, your first initial, you talked about Indians being vegetarian, but still dairy products are very popular among Indians. And I think it is more to do with probably cultural and cultural factors have a major role, because it's always from ancient periods, once children are weaned from the mother's milk, the next they think is cow's milk is the next substitute, because it is rich in calcium and rich in protein. So that has been culturally imbibed into us. So that is one reason, though majority of the Indians are vegetarians and animal products, I mean, like meat and poultry are less compared to the West. This part of it is like part of the culture, and that's the challenge for us to address. So when we talk to patients about whole food plant-based diet, they're ready to forego meat, they're ready to forego fish, but they're not ready to forego dairy products, especially milk. And we are trying to now look into. So, there was an eye-opening slide by Dr. Sailesh Rao on how much of lactose intolerance Indians do have. So probably we are thinking that this has to be more evidence on this aspect has to be gathered, and our patients have to be given awareness on this component. Probably that would make them bring about a change in our patients.
Right. Yes, thank you. And I do see, I hear you say that, children and adolescents and young adults are very interested in the environment and the impact of our food choices on the environment. But also, the word ahimsa, was founded in the tradition of non-harm. So as the grandmothers, we would really like to bring the message to all organizations that I think we need to include all three in that: human, earth, and animal liberation. And the gift that that brings to the world and to ourselves, not ingesting harm and suffering. So ahimsa, meaning non-harm, which is said to be the most beautiful word. And one of the grandmothers from our community, Judy Carmen, wrote a book called Homo Ahimsa, Who We Really Are, so that we're becoming Homo Ahimsa, people of non-harm, as opposed to Homo sapiens, which used to mean intelligent people. But we know that's not true. We have not made a lot of intelligent choices for humanity, for the animals, for the earth. So I'm really excited to see the development for your communities in bringing all three of those aspects together for your people. Because the one thing I do know, having grandchildren, is that they get it. They get it on some deep level that we're heading down the wrong path in every way, towards the animals, towards other humans, and towards the earth. And I think that bringing in all three of those pieces will always be a game changer. And I think we're ready for it. I think we're ready to talk beyond human health.
Yeah.
And
So that's the whole plan.
I'd heard you say earlier that some of the people that aren't unhealthy, they can't hear the message yet. And I get that, because I completely changed my diet. I was already eating quite well, but completely changed my diet when I was very sick with Crohn's. Went completely whole food, plant-based, mostly raw. And so that initiated the thought process of all the other things. But for all the people who are still managing to think that they're well, we can bring the environment and the animal aspect into it.
Exactly. That's the whole point. So I would like to add that Dr. Sailesh Rao's session was a game changer for us, and some of the previous sessions as well, but that was the game changer. So we are planning to involve students, because they are going to be the future physicians. And as you said, like, it is easy, they get the environment aspect easily. So we are planning to bring in a health club or an eco club where students would be taking the lead and we would be taking the backstage. And we were going to bring about awareness on plant-based food and environmental health. So that's in the pipeline. So probably in the next month or so, we would be starting one, and that's how we are going to promote plant-based diet. And I think the huge challenge would be about dairy products, which we hope would overcome the challenge and possibly move towards a healthier a healthier community and a healthier environment.
Beautiful. I can see lots of screenings you'll be having in McAdoo, mother's milk, and give them the milk back to the mothers. Thank you so much, Professor. Any final comments or thoughts that you would like to share with the audience?
So so what I would want to conclude is, like, I think as physicians, we have a major role to play as far as climate health is concerned. So we have a huge role to play for the health of our planet. So it's like, for the patients and for the community, when we talk to them about the benefits of plant-based diet and on their health, I think we also should inculcate to them that they also have a responsibility towards their environment. So when they become healthy, by adopting a plant-based eating style, they are also contributing to the environment, which I think they would leave the future a better place for their children and the grandchildren, who would also probably see them and continue to adopt a healthy lifestyle. And I think that's the final message I have for all of them, the listeners. Yeah.
Thank you so much for your rivers of kindness to the ocean, and really appreciate your work.
And I thank you. I got to go through and learn about the kind of work you're doing and how you came out of Crohn's with your lifestyle, and then how that was infectious in bringing out such a huge work you're doing. And I'm already ordered the book you've written, and I'm going to read about that book, and I think that would also help us and learn more about how we are going to heal the climate and change the world.
Thank you so much for your work.